Older patients and people with pre-existing health conditions can develop some severe symptoms.
If you have a long-term health condition, you may be feeling anxious about contracting the coronavirus. Our chief medical editor, Dr. Corey Hebert, joins us now with some very helpful information. Doctor, how are you?
Oh, we are really fighting the fight out here. But, things are going to get better. But I agree with the Surgeon General. They're going to get a little bit worse before they get a little bit better. And that's because of the outcomes of the social distancing. You won't see that for at least 4 to 6 weeks because of the 14-day incubation time of the virus. And, China saw that type of flattening the curve very abruptly, but we're not instituting martial law like they did. So we're going to see the curve start to flatten, but it's going to take a few weeks.
Dr. Hebert, let me ask you about these underlying conditions. What exactly are those so that people know? I've had that question asked of me several times.
Okay, so underlying health conditions means that the conditions that you have that you were being affected by before this COVID-19 even came about. So that's hypertension, diabetes, any type of autoimmune disease, pregnancy, any type of a cancer. Also, if you have finished the cancer and you have beaten the cancer, but you are still immunosuppressed, anybody that's taken high-dose steroids, anybody that has sickle cell disease, anybody that has chronic pain syndromes can also be high risk. So there are a lot of things that can be pre-existing that can make this much worse for you. One of the things that I really have to stress is COPD, which is chronic obstructive pulmonary disorder, as well as asthma, because this virus has a predisposition for lungs. It likes to get in lungs and cause pneumonia and clog up the lungs. So if you have lung problems, then that is something that you need to really be aware of and take a lot of precautions so that you don't come in contact with people with known disease.
We've heard it over and over. Most people will only see mild symptoms from the coronavirus and recover. Some may not get any symptoms at all, but there is a small group most at risk who will get very sick and die. Among those most at risk are older people and those with underlying health conditions. The big question is, what are those underlying health issues?
For the most part, the people who get in trouble and ultimately, tragically, would die from this are people who are elderly and or have underlying conditions, heart disease, chronic lung disease, diabetes, obesity because of the difficulty in breathing back and forth. However, every once in a while, you're going to see a one-off. You're going to see a 25-year-old person who looks otherwise well that's going to get seriously ill. But the vast majority of the people who get into trouble do have these underlying conditions.
Cancer, HIV, and heart disease. 82.6 million Americans have heart disease, including nearly 48% of African American women and 44% of African American men. That's according to the Heart Foundation. Then there's diabetes. 34 million Americans have it, according to the ADA. 11% of black people have diabetes. Other health issues include chronic respiratory illnesses like asthma and COPD and high blood pressure. But there is good news. According to one study of 45,000 confirmed cases in China, fewer than 1% of healthy people who contracted the COVID-19 virus actually died. For those with cancer, hypertension, or chronic respiratory disease, it was 6%. For diabetes, the death rate was 7.3% and 10.5% for those with cardiovascular disease. Patients 80 or older were nearly 15% more likely to die of the disease. That means if you're younger than 80 years old, you have at least a 90% chance of surviving the coronavirus. Right now, scientists around the world are working to understand why some people suffer more than others and why the novel coronavirus is more deadly than other coronaviruses.
Yes. So this is something that we have been working on. We're working tirelessly. We're working with Dr. Anthony Fauci so that we can make sure that we're doing everything right to combat this horrible disease. But what I will tell you is that what you must do is practice the social distancing. It will flatten the curve. And nobody wants the United States to go into a real lockdown, but we're asking you to be responsible enough so that we don't have to do that. We don't have to become China. But without your help, that's what would have to happen, and when we can't have that. So, guys, I know it looks bleak, but I promise you, there is a light at the end of this tunnel. It's not a train, okay? Well, I promise you.
With that being said, Doctor, I'm mindful of being in the state of Florida, where there's a considerable elder population. spring break is happening, and you wouldn't know there was any coronavirus out here to look at the beaches for all the young people out there who either don't know or don't care that they could be carrying that disease off someplace else. What would you have to say to them?
Well, all I want people to do is to think about the 1918 pandemic of Spanish flu. Where we get this whole concept of flattening the curve is that in Philadelphia, they knew about the Spanish flu, but they had a big parade, and right after that parade, they had 16,000 deaths because they did not do what they needed to do to quarantine. They went on with the parade. 900 miles away in St. Louis, that they knew about the Spanish flu. They knew about it, and they quarantined everyone. Once they quarantined everyone, they had a couple of hundred cases of death as opposed to 16,000 in that same amount of time. So we know that what's going to happen. We know, we've seen this. So anybody that thinks this is not real, all you have to do is look at your history, because history will repeat itself. And I hope that it doesn't repeat itself in Florida, because this has gotten out of hand in Florida. I think the governor probably needs to step up and do something a little bit stronger, because the fact that these kids are out there, they're not going to really get sick. They're going to make sure they're going to pass this to their mothers and grandmothers, and they're the ones that are going to die. And that's the thing that is most upsetting to me about this they're being very irresponsible.
Yeah, let's hope that they handle these serious warnings so that we don't have to go into lockdown like China. And also today we learned that England, Prime Minister Boris Johnson also put England under mandatory lockdown measures because the people there would not listen, Dr. Hebert. So hopefully we will not face that here in this country.